What's up, you guys? I'm Amber,
And I'm Patty.
and welcome back to another episode of Chromosomes and Chaos.
To two moms, two perspectives, and one badass podcast. I'm really excited
I'm excited too.
because today we have a good friend of mine, ours, Dr. Lisa here. She is a doctor. She is an advocate. She is the mother to a kiddo with an extra chromosome that we love so much. And so thanks, Dr. Lisa, for being here.
Yeah, I'm excited.
Well, I'm going to get things started. And I'm sad that I don't know the answer to this question, but did you have a birth or a prenatal diagnosis? And tell us about it.
So I had a prenatal diagnosis. So I went in and had the nuchal translucency test, and it was actually just 1 millimeter more than the what you would normally do for testing. But because I was like, I need to know for sure, I got the cell-free DNA, and then that was only 95%. So then I went ahead and got an amnio to make 100% sure that it was. That's how we found out. It was interesting because the genetic counselor, when I first went in, she had kind of discouraged me from doing further testing because she's like, it's only 1 millimeter. It's probably going to be fine. I was 34 or whatever, so just under the testing thing, but I just felt like not geriatric yet. Yes. Geriatric pregnancy, not on my chart yet. But I wanted to just be sure just because I needed to know. And so then when she called me, she was, of course, very apologetic about trying to discourage me from getting the testing, everything. So
Did you get that done at 20 weeks then?
Yeah. It was actually at 13. So it was so you can get the nuchal translucency between 11 and 13 weeks. So that
Then notice markers up.
So then the increased size. Yeah.
So I'm always curious, like, as a doctor and knowing like your history in the medical field and all of that, like, how did you receive that information and how was it actually delivered to you? I mean, I know mine was not in the best way, and just like the delivery of information and diagnoses in the medical world.
So it was the genetic counselor that called me, so not a physician or anything, with the cell-free DNA test, which is what we got for the follow-up testing. And she started out with, so I have some bad news, which is typically what they say. And so that's how it started. And so I immediately was most worried about all the medical complications that can come with it because it's my world. And this was before we had our 20-week anatomy scan, so we didn't know anything yet. And so the question was, do you want to terminate, all the questions. Do you want to terminate? Is that an option for you? And what are your concerns and all those kind of things? And so, of course, I didn't have any like medical questions for her or anything like that, but I did want to get into my anatomy scan as soon as possible so that I could see if there were any other like medical complications or anything like that going in. And so we did the amnio the next week and then went in for the 20-week anatomy scan at like 19 weeks.
That's probably long, because how many weeks did you have to wait until you could do that?
Yeah. So I think I got my diagnosis at, like, we were on the later end, so 13 weeks. So then I think 14, and then so like 5 weeks later before we could get in. Yeah.
So explain a little bit more on the genetic side of it. So your doctor didn't talk to you about the results. So is there 2 avenues you can go? Either the physician tells you or the genetic?
I have no idea. I would assume, I would have thought that the perinatologist would have called, but it was the genetic counselor that called. So I have no idea how the perinatology world works, and how people get that diagnosis. I don't know if they just assumed since I was a doctor that I wouldn't have medical questions because they knew that on my chart and everything. So, and obviously I didn't really have any genetic questions either. So it was just someone just giving me the news.
And how do you feel like in that moment you handled it? Like,
I cried. Yeah. I was
Is
super.
your first?
She's my second. She was my second, yeah. So my son was 15 months old at that time, I think, or something like that. He was 20 months old when she was born. And so I cried immediately because, again, I didn't know like what. And it was kind of a shock because we were like, oh, it's only 1 millimeter. It's probably fine, you know, all that stuff. So it was like I was very set up for like.
You were waiting for it to come back. With,
positive. Yeah, like positive in quotes. So you know, and then I told my husband later, because of course they called me when I was at home by myself, and then I told him later, and then he was like, oh, I hope she doesn't get made fun of. And I was like, because we also got the gender at the same time. So we knew she was a girl. And she has Down syndrome. Yep. Yeah. So but yeah, so that was his biggest concern, and I was like,
I think that's valid. I think there's a lot of things that cross your mind.
And I can definitely see that after knowing Joe.
Yeah. Because I mean, I was like, you know, I'm more concerned about her like living through the birth and everything, but yeah, let's worry about when she's in school.
A lot of questions.
Yeah.
For sure.
Yeah.
And so at that 20-week anatomy scan, so did she have any heart defects?
She had one of her valves was a little bit misshapen, or at least it looked like it did. It ended up, like, we found out later that it ended up being fine. It was just how it looked. So that was the only thing on her heart scan, and everything else looked completely fine.
Do you guys know what the statistic is on how many kids born with Down syndrome have heart defects? Because I think it's pretty high. Like, I don't.
It's not as high as you would think. Okay. It's just that if you have a heart defect, you're more likely to have like a chromosomal anomaly.
Gotcha.
So that's where the association is. It's the opposite direction. Yeah. So
I read somewhere that was like 50% of kiddos.
I mean, they have like, but not major heart defects. So like a leaflet that's like off or something.
She had 2 holes in her heart in utero, but then when she was born,
they closed up. Yeah.
And so we were incredibly thankful for that. But
yeah. So, yep. But she ended up, I had a very complicated pregnancy. I had a placental abruption at like 32 weeks, which has nothing to do with Down syndrome. Yeah. I had, I was very lucky. My OB that I talked to that I see and who I'm friends with, actually has a niece that, has Down syndrome, and so she was very encouraging. So she actually was much more helpful than the perinatology team, and was just like, you know, I'll support you in whatever you want, but I want you to know, like, these are your options. But here's my niece, and she's amazing, and you know, she does all these things and all those kind of things. And then I only reached out to like a few people, so a lot of people did not know until even probably months after she was born about it, because I just didn't. Being in the medical field and knowing what everyone else was going to ask me, I didn't want to deal with any of those questions.
I'm not ready.
You're not the mental capacity.
Yeah.
The mental spaces.
Yeah. Because I was still in the, like, I got to get through this pregnancy. I don't even know if she's going to make it through this, because was one of my biggest worries too. Like, I mean, you're more likely to have like a miscarriage or those kind of things. So once we got past, okay, there's nothing imminently wrong, but are we going to make it through this? And then I had a placental abruption at 38 weeks, and I was in the hospital 3 different times before she ended up being born at 36 weeks. And then we ended up in the NICU for a month. So it was just like,
all the things.
It was a lot. And so I did not have the, you know, emotional capacity to deal with anyone else's.
Yeah. And your first one was good though. Like, you didn't have any of these things that happened in your first one?
No.
Okay, just different pregnancies are different.
So he was born a week and a half late.
Okay. Oh my gosh.
Wanted to stay in there.
With
so a week and a half late and then 4 weeks early.
Yeah, and 4 weeks early. And he was 913. And so I ended up having a C-section with him because he was big, but also because I was in labor for like 30 hours with him before, and then I just never progressed. So, and then he also ended up in the NICU for a week.
Yeah.
That's
a big baby. Those are the ones that come out and they look like they're 4 months old.
Yeah, he was huge.
I had 2 of them.
Right.
Yeah, he was huge. Yeah. And then Aileen was 6'2". Yeah. But still pretty big at 36 weeks.
Yeah. I feel like she's such a peanut, but
she is now. Yeah.
I feel like there's always topics of conversations around like the delivery of information. So like having that come in who've received diagnoses or things like that, like what is something you wish in the medical field was maybe either a little bit different on how people provide diagnosis or information, or I don't know, has that changed at all?
It sounds like not. When I talk to people that have gotten diagnoses, I mean, I would love for perinatology to reach out more.
So if you work in the perinatology field, Dr. Lisa
Wants to chat with you.
or any of us would
Yeah.
be happy to.
Yeah. I mean, like I said, I was lucky with my OB-GYN, and then one of the other OB-GYNs that I saw frequently, they were both very, very supportive and like not like one time she was kicking me really hard and I was like, maybe she won't be that hypotonic. And the OB-GYN laughed at me, which not like laughed with me. She was like, oh, Lisa, just like you were,
got it.
You're so worried. And, but it was just, one of those things. So I was lucky that I was able to, because of my field, like see only 2 providers and things like that. Whereas most of the time you just end up seeing whoever. But I mean, I did have one of the OB-GYNs tell me that, trisomy 21 Down syndrome isn't a risk for early miscarriage or early preterm labor. And I was like, you don't know what you're talking about.
Actually, you're wrong.
You're wrong. Yeah, that's weird that you said that. So, but yeah, I feel like perinatology does not do the best job. I hope that my partners are doing a better job because I've tried to like really counsel them and talk to them, and then they try to, if I'm available, then they get me involved when they can.
And it's crazy because you think just with more awareness, right? There's just so much more awareness around Down syndrome and longevity of life and living these fulfilling lives that you hope, but we're not in the field to see it, right? We only know about our experience and other people's experience we talk to, but you hope that it's coming around for positivity and things. But, I'm sure there's families out there that take the diagnosis. We don't know how many people are terminating at certain times.
Yeah.
And they want to hear that you can terminate because to them that's a relief, unfortunately, right? Or, when you get the diagnosis and you're taking it on and you want to be excited about it, how they can deliver that is hard, I'm sure. But
I always say like the manner in which you provide information just has an effect on how it's received. And so I think that there's always opportunity for this is what we see. This is what's happening. I would encourage you to connect with a family, find another person before like make an informed decision, right? Yeah.
And
Our
I think that's around
experience was awful.
Right. And I think that's around any disability or anything that like you have to have a script that's a positive script to just be like, here it is, right? And just go with that every time. That's uplifting. I wonder if you have to deliver the news so many times or often you just get numb to how you do it. Like when I don't know. I mean,
it's hard because in the medical field, like we're not, like we're taught the pathophysiology of it. Like this is like, these are all the things that you need to monitor for. These are all the things that can go wrong. And that's what, like as a physician, that's what you're supposed to be monitoring for. Like you need to know the heart stuff, you need to do that. But so you don't know the social aspect of things. And we're not taught that.
Human side.
Yeah. And so that is one thing that I do try to teach as well. And so I do some like grand rounds and things like that to try to teach those kind of things as well, to get it more out there that, all the research that is out there and the increased longevity and therapies, early intervention, all those kind of things that make a huge difference.
And that makes sense, like the logical side. Like doctors are probably really logical.
Right, exactly.
And it's the emotional side that there's some disconnect there, which makes sense. And this is for sure.
Yeah, so it's just about like knowing that the human aspect of it, and so reaching out. And so one thing that's good is like just having Aileen around is that she, my partners know her and know and see what she is and who she is and all those kind of things. And so they at least have that perspective. Even if I'm not available, they can talk about her still to my partners and that kind of stuff. So they at least have that experience.
Well, they have the connection to you.
Right.
That
Like
too.
If
they have a patient that got the diagnosis, like they can reach out, like just to have that.
Yep. Absolutely.
They have you.
They do have me.
Yes. And well, it's crazy because I feel like we're so, obviously as families, we're so heavily involved in the Down syndrome community. So to me, there's a ton of Down syndrome kids.
Right.
All over. Yeah.
Yeah.
But really, if these doctors are giving delivering babies, what, 1 out of 1,000 or whatever
Yeah.
the probability is. Like they're not, some will never deliver a Down syndrome baby in their life.
Right.
And so, and they might not ever know anybody too. So they're new to it like we were when we got the diagnosis.
Right, exactly.
And they just need to know somebody that has a child with Down syndrome to have that story to tell, like, hey, they're going to have a really good life.
Yeah.
Yeah.
Do you think that having Aileen has changed how you are a doctor, or like in the manner of like how you patient people?
Yes, and
Just the
and no.
intersection.
Yeah. Yes.
Right?
There are some things that have changed. Like the biggest thing that I think, I mean, I've always tried to have like the human side of things. But one of the things that has always changed is this, that has changed is more like knowing more about like ancillary services and getting those like physical therapy for all kinds of things.
What does ancillary mean?
Just adjunctive outside services that aren't just like medical, just like the medicine part of it, but just like knowing that there's other things that can help. That's not just like, oh, your child has reflux, just give them a reflux med. There's like, sometimes it's because of the way they're positioned and things like that. So it's like other things that I've learned have made a huge difference for all my patients, not just patients with Down syndrome and things like that. And so I think that has made a huge difference. And that's one thing that we do not get in our education, because there's so much to learn that, like, but you also don't necessarily learn to what you can consult for either, because you don't know that you can consult for that kind of thing. So that's the other thing that I try to like increase and teach.
And that's what our pediatrician does so good at, not saying she knows everything.
Yeah.
She's like, we have specialty doctors that go down the reflux path.
Yeah.
That go down the orthopedic path, and she just guides us in those, and I think that's super important for those doctors not to have to know everything. Like, you guys don't need to know it all, right? Because there's a lot of information out there.
Yeah.
But just to have those resources to send other people to is so helpful.
Yeah.
So helpful. But you're right. Like, if you didn't have a child that needed extra stuff, you wouldn't know of all these avenues of things that are out there for different things.
Yeah. So it's made a huge difference, and it's helped with all, like I said, all types of patients, not just those that have like disabilities or anything like that.
How many kiddos with Down syndrome do you have? Do you see?
Oh my, I feel like I see way more than anyone else, but I don't know why.
Well, 7. So I have a question. So going back to finding a provider. So Pierce was born, and, I don't even know how we found our doctor that we have, but she was taking new patients. We read about her, felt comfortable. It wasn't even a referral or anything. But these parents that get this diagnosis, what do you think is important, whether like when your kid has Down syndrome or a disability, to find in a provider? Or what would you recommend? Like, is it necessary for them to have a lot of experience with a kiddo with a disability or Down syndrome? Or do you feel like that's
not absolutely necessary? It's definitely helpful if they've had more experience and things like that. I think the things to look for are, one, someone who's going to listen, because you're going to have more questions. You're going to have probably more things that come up, more visits, which is okay. And someone willing to look things up and reach out. Because if someone's just like, oh no, they're fine, one of the things that medical providers used to say is, they'll walk when they walk, right? And it's like, well, yeah, but like, what if we help them? And so if someone's willing to like reach out when they have a question, even if it's to like a different provider that does have more experience or something like that, or, a GI doctor with the stomach issues or anything like that, someone that's willing to not just like feel like they have to know it all, do it all, and not do anything. So someone that's willing to like reach out, and someone that has like good communication is going to be the biggest
coordination
thing.
of care.
Yeah, I mean, coordination of care is huge in the pediatrics field, and
no matter what.
Right, no matter what. And as a primary provider, like, you need to like and be able to reach out and know your resources and things like that.
And that's such a valid point. And that's what it made me feel comfortable with her right away. She was straight up with us. She's like, this is my first kid with Down syndrome, but I'm super excited.
Yeah.
And you could tell when we came in for that appointment, she just told us she did a bunch of research and reading and all that. And so we're like, And she's been so good for Pierce. She's been awesome. She'll do literally open book, whatever we think that we need, whatever she thinks that we need, she'll find a way to make it work.
Our pediatrician is retiring at the end of the year.
What?
And so I think we're going to be switching to a local provider who also has a kiddo with Down syndrome.
Oh,
so
perfect.
that will be, I think, fun.
She just won. The one that just won
She was runner-up.
The runner-up for the Grimes location for the best pediatrician.
Oh, I had no idea.
Yeah.
Oh, cool. Yep.
Yeah.
Awesome.
Yeah.
Yay. They might not know it yet. So if you listen to the podcast, hey, we're going to come see you. What do you think? Like, I remember when Addie was younger and like we were navigating some things, and I'm always curious, like, what would be things that you would tell parents to be mindful about, or like to ask, like, typical kiddos have labs or blood drawn once a year, right? But really it's probably more important for kiddos with Down syndrome, especially their thyroid or things like that. Like, I don't know if there's just one thing, but like if there's a piece of advice that you could give parents about what to expect in the medical world, what would it be?
So when I meet with families, I give them the healthcare guidelines for families. Which has the chart. So there's a chart from the AAP. So that'd be the one thing I'd say, like, look at the chart from the AAP that just tells you exactly what your child needs over the next, like, 5 years.
Yeah. Is that for Down syndrome specifically? Okay. So it's a chart.
Can I have that?
Yeah.
Well, I mean,
maybe we can put a link. We keep saying we put links on our YouTube. We don't put links.
We should probably.
We will try our best to remember to put a link.
Yeah.
This is still a work.
So what's the AEP stand for?
American Academy of Pediatrics.
Okay.
Yep. Okay. Yeah. So there's healthcare guidelines specific for Down syndrome for exactly what they need, like on a year, like monthly when they're little to yearly basis and everything. So that's one of the things that I hand out.
Yeah. It's good.
Yeah. I remember when Addie was little and we were seeing a nutritionist, and it was in another city. They refused to use the Down syndrome chart for like height, weight, all of that stuff. And so Addie was never on the chart.
Well,
right?
Of course not.
And so she was always malnourished, in the nutrition danger zone. And like, I was literally fuming at one point in time. And I'm like, we're not doing this. Cause like, I promise you, she is not malnourished. The girl can eat more than me.
Right.
She's just little. Right.
Yeah.
And so, but on the Down syndrome chart, she was above average. Right.
And
that's so crazy because they would always show the typical chart.
Yeah.
And then they would, and our pediatrician would show, but on this chart, like, and she would always made it like a positive, like, he's going to be a little less here, but on this chart, he's right in there. And it makes you feel good when you see a chart that he's actually on.
Yeah. Addie was not on the chart and the boys were off the chart. So these extreme opposites.
Right.
Same.
But I think as a pediatrician, it's important to show both, because I am interested like on the typical chart just to see like where he's even at, because it's kind of interesting.
I'm not even interested. I'm like, don't show me the typical chart.
We're good here.
Yeah, I don't need to see.
And then I'm like on the other chart. Okay, great.
Yeah.
He's gotten tall. Like, Pierce might be as tall as Tyler. Like, he is. And everyone that has seen him lately is like, he's gotten tall. I'm
Pierce
like,
is really tall. Alien is not tall.
And he always used to be short, though. And all of a sudden, he's sprouted up.
I think Addie's tall for her age and on the chart. But then I also like see her standing next to like the rest of the third grade class. And I'm like, oh, she's so tiny.
Yeah.
Yeah.
But typically, though, they're not tall, So
Correct,
your girls will probably, and Pierce probably won't. Yeah, which is totally fine. But it's just their stature is always.
Yeah. Yeah.
So what message would you tell families receiving their diagnosis today?
Find a resource, look at like can I say the DSDN?
Yeah, absolutely. Yeah. Any resources
Down Syndrome Diagnosis Network, Jack's Baskets is a really good resource. They have a bunch of things there. They'll send you a basket with a bunch of resources in it. So those are two really good places that you can find stuff. And then Gigi's has and if you have a Gigi's in town, we are lucky that we have one.
Very lucky.
We are so lucky. but they have resources
Yeah.
as well, typically, and so if you can at least find a Gigi's close to you, then they can connect you with the family, because I think connecting with the family is
100%.
huge.
Yeah.
It's always good to know someone that goes through the same thing you do, right?
Yep.
Because other people will say, happy for you, I'm sorry, whatever they feel.
Yeah.
But when you have that connection with that one person that just knows how you feel, there's just something
Yeah,
about
then
it.
you don't
It's-
have to
yes.
explain it.
Yeah. Yes.
that
right.
is-
Just
Yeah.
I get it. I get
Yeah.
it. I'm right there with you.
Yeah.
Yeah.
Do you think there's a difference in like your advocacy efforts, like as a doctor, as somebody who advocates for kiddos with Down syndrome, like the joining of the two?
Yes. I mean, it's hard. Like, I would love to do more if I could. I would love to get more involved in different things. It's just a time
Right.
constraint, and advocating for Aileen in general is a time constraint. And so doing that, but I went and talked to her classroom, and so we talked to them, and made like some about me sheets to give to her dance troupe too, because she's in dance, and so just trying to do like little things like that, just to explain things and give awareness to people. But I try not to be too medical when I'm advocating, because I feel like unless someone asks me, it's not really like, I'm like
That's
more of
probably
like, yeah.
You're defining the balance.
Yeah.
Like the medical side versus just
Like if someone
a
asks
real
me
side
a medical question, I'm totally fine with answering it. But otherwise, like when I'm at Gigi's or, in my other roles, then I try and just be like
the mom.
To,
yes,
This is
her.
the mom hat.
Absolutely. And which you should be, because you would drain yourself out if you just constantly were in that role.
Yeah.
Right?
Yeah. So I try and separate it, but, I try not to be, because also, everyone has their own thoughts and opinions, and I try not to step on too many toes if I can. But as a doctor mom, I would say it is hard, because I do try to balance it also with my kids, because I don't want to doctor them either. So I often will call my friends and ask them, like, am I thinking this, or am I underthinking it?
What do you think? Because I have my own thoughts.
Yeah. Here's what's going on. Here's some pictures. Please let me know what I need to do.
That's so funny, because I have another friend who is a doctor, and their wife was talking about how they do this all day long, but they can't do it for their own children.
Yeah, it's hard.
Crazy. Yeah.
It's hard because it is like, it's another world.
Yeah. You do surgery. If you're a surgeon, could you do surgery on your own kid?
No. It's actually very inappropriate. Yeah. To do surgery on your, unless I suppose if you were I suppose if you were the only one around and it was an emergency, you could do it, but it would be a very hard conflict of interest, and it would be really hard to do. I don't think anyone could do it. I can't imagine cutting into my own child. Like, I couldn't even watch my son's circumcision. Like, I can't do that.
So most recently,
I could give him shots. That's
shots fine. There are things that always, I think, I don't know how I want to say this, but so like Addie just went and had ear tubes, and somebody's like, "Oh my gosh, are they okay?" And I'm like, "It's just ear tubes." There's something about Addie's been under anesthesia more times than I can count. And it's like my dad, who is 75 years old, just went under anesthesia for the first time in his life at 75.
Yeah.
And he was so incredibly nervous about it. I'm like, Dad, you're going to be fine. Like, there's so many things that we're numb to, but changing her G tube and flushing it out and
all that stuff is hard.
Yeah. But it's normal, right? Like, there's just a sense of normalcy. I'm like, oh, it's no big deal.
Yeah.
And to other people, it's like, oh my gosh. I'm like,
how can you
So that wasn't hard for you to change that stuff out or do anything like that?
No.
Yeah.
I mean, it is what it is. You just do it. I mean, that's part of it, is you just end up doing what you have to do, right?
Yeah, very much so. The first time, Lisa's going to kill me. She went to go change Addie's G tube, and she didn't get the cloth over it fast enough, and so stuff started. Started coming out. She's like, "Oh my god! Oh my god!"
Just little stomach juices. It's no big deal.
Get the tube back in.
Oh, that's hilarious.
Yeah.
It's fine.
It's funny because when my kids go under anesthesia, I have a meltdown every time.
Yeah?
Because I know about all the complications that can go with it.
I don't want to know about any of those
Nope.
complications.
So those are all the things going in my mind, even though I'm like, they'll be fine. Everyone's fine. It's going to be fine.
Yeah.
But I'm like,
I don't know what size they are. They're really big syringes.
Mhm.
Like we had so many of them when Addie had a G-tube.
To clean it all out and stuff.
All of the things, but like I've used it as a turkey baster before because I couldn't find my turkey baster, so it was perfect. Like I'm using a medical syringe.
I love it.
Fine.
so don't eat turkey at your house.
Right. Are you hosting this year?
Yeah, absolutely. You should come on
No
over.
one's coming.
We do a turkey trot, and then it's fine. It was clean. I opened it out of the package, sterilized it, and then used it as the turkey baster.
Actually, I think this episode drops after Thanksgiving, so everyone's safe.
Oh, perfect.
Everyone's safe.
Yeah.
So
Yeah.
That's funny. Well, Pierce has to go. He has another knee surgery coming up.
Yeah.
So it's like, oh,
I saw
anesthesia.
that.
Like, it's weird though, because my thought of anesthesia for tubes is way different than my thought for anesthesia for like longer surgeries.
Well,
And
it's different. It's
right,
definitely a
right.
lot. Yeah, because usually for tubes, they just mask them and it's so quick.
Addie like literally will take the mask and put it on herself.
Aileen too.
Yeah.
Well, if anybody is getting tubes for their kids, it's the fastest thing
Yeah,
ever.
you can't even sit down.
No. So
10 seconds.
the very first time Pierce got tubes, we were getting ready. We're like, oh, probably like an hour. We'll go down to the cafeteria, we'll grab a coffee. So they go take him back. I'm not kidding you. We like get in the elevator and push the button down and it starts beeping. And we're like, something happened. Oh my God.
Yeah.
Like we were freaking out. We go up. The doctor's there. He's like, we're done. And they probably saw us sprinting through that, like by the front desk.
Yeah.
Like, what are these parents doing? They're like, we're done. Couldn't believe it.
Yeah.
Addie
So
just
fast.
had her another pair done like a week ago, and the receptionist was like, okay, make sure that a parent stays here at all time. And I'm like, where are we going to go? It's going to be done in a minute.
Right.
Yeah.
Now, lesson learned.
I know they should really tell people that before. Because so like when Julian got his tubes, Aileen had just gotten out of the NICU, but she was on oxygen. So we had like her whole oxygen thing, like all this stuff. So we get all this out, get it all set back down. And then they're like, and now you need to go back to the consultation office. And we're like, grab it all. And I was like, oh my God, why did we even bring her? Like we should have just like, but I didn't.
But they should be like, I wonder if they can't, because if it's longer, then people get
Right.
Who
By the way,
knows?
this takes 10
But at
seconds.
least 30 minutes. I don't know.
Yeah.
This won't be long. That's what they should say.
Yeah.
'Cause I
Don't
think
sit down.
A lot of people are probably shocked.
don't get food.
Yes, right.
So
Don't go to the
we
cafeteria.
just did an episode not that long ago on just like the heaviness or things like that. But like, how do you give grace for yourself? Like, how do you find balance or find grace? Or, I mean, is there really a balance? I don't know.
I just try. I mean, you just survive, right?
Survival wins. Survival wins.
Like you're just doing the best that you can and try and get. I'm much better at giving everyone else grace than I am giving myself
That's the way it is
grace.
for most people, though.
Yeah.
We give it to others, but we don't give it for ourselves.
Yeah. So I just, just like I'm just trying to do my best I can. And as long as
And I think
kids
that's
grow
grace,
up.
because you're thinking about you might not. You're at least thinking that you are doing your best versus portraying it to a negative of I suck. So
Well, some days.
that's some of the best grace I know. That's some of the best grace you can give yourself.
Yeah. I'm always worried that I should be doing more, that I could be doing more, and all those kind of things.
I have those same thoughts all the time.
Mm-hmm.
I think there's a balance between like, do we need more therapies? Do we need to do behavior therapy? Do we need to do this? And letting them be a kid. And do we have something every single day? And are we, all of the things. There's always more.
Mm-hmm.
But like, also, can we just
breathe?
Yes.
Can we just breathe? Can we find, I don't know if there's a balance, but
yeah.
I don't know if anyone has a balance with the kids.
No, no matter disability or not.
Disability or not, like everyone's just busy.
Going crazy, stir crazy.
So every episode, you get 2 things on the hot seat. And I'll go first, or Amber can go too, before you. But we do something called Chaos Corner. And so we get to share something that's chaotic, WTF moment, or is this really happening, that we share with everybody. And I think one of mine from this week is Tuesday morning. We had an incredibly early meeting, and we're in the season of life that we have 3 kids at 3 different drop-offs at 3 different times. And so it's already chaotic. And the meeting I had was on the south side. So I live in Grimes. It's like half an hour away. So I was taking the baby to daycare. Baby, he's not a baby. He's going to be 3. I was taking Trice to daycare, dropped him off. But it was like getting everybody up, getting everybody dressed, out the door, ready to go. I didn't brush my teeth. And so I finally get everybody out the door, get him dropped off. I have like 5 minutes to spare to get to this meeting. And I stop at the gas station and I get one of those travel packs of toothpaste.
Yep.
And I'm in the quick trip bathroom brushing my teeth.
I thought you were going to say you picked up a pack of gum.
No.
That would have been fine too.
I mean, no, I stopped at the gas station and it was either doing it in the bathroom or I had a bottle of water in my car, like outside the door, like in my car, like swish and spit. I don't know. And I was just thought to myself, I'm like, yep. And I'm like in a very professional dress, heels, all of this stuff. I actually like put myself together that day. And I'm like, yep, just hanging out in the quick trip bathroom, brushing my teeth. I'm swishing
That's
spit.
amazing. That is
I mean,
amazing.
why not?
But it is.
It's
That's
fine.
just the chaos of life. Of like, when you got to get it done, you just got to get it done.
Yeah.
Just got to do it. Do you have anything that came to mind yet?
I mean, Aileen's been using her curse words very appropriately.
Very appropriately.
In long sentences. So that's great.
Your facial expression.
No,
That's
just
really
to you
great.
guys or
Oh, no.
everywhere?
Oh, no, we share. Yeah.
Yeah.
Yeah. So that's great.
Mm-hmm.
So
We got some phone calls from school. We did.
only one.
Yeah.
Yeah. She's been trying to do them more under her breath, I think.
Right.
So that's good.
Definitely in context.
Yeah. But great. Yeah.
Yeah,
Like
like-
long sentences.
Because I cuss under my breath all the time.
in context, appropriate. Yeah. So
It's so
Or it's like, yay, a 6-word sentence.
why did it have
I
to
don't know.
have the F word in it?
Well, that's funny because one of mine was we were singing a song. I don't know, like Bad Mom. Some of the songs we listen to have cuss words in them.
Yep.
But I think it was like a kind of a kids one mix between an adult kids song, whatever. But the word shit is in there. So then Pierce is just in the back singing, and I was waiting for it because he was just going, and I'm like, oh, he's gonna just say it. And so the other two are probably listening to me. It's just like shit, and then everyone just and it's funny. Like it is funny, and then he thinks it's funny too. So now he just every time that song comes on, he just says it.
Yeah. No, one of Aileen's favorite songs is Vampire. A lot of curse words in there.
Vampire. I don't know if I know that. Do I know that?
It's by, I can't remember who it's by, but it's got shit and
But it just happens. They need to listen to good music too sometimes.
yeah. My kids do have good music taste. So.
K-pop Demon Hunters.
K-pop. We got a lot of that going. Thankfully, there's no curse words in those.
No. That has just been the theme.
Although I don't know what those Korean words mean, so they could be curse
We should
words.
probably learn that.
I just think every morning's chaotic though. Like the other day, I'm like, this is just nuts because I try to go into the gym, then Tyler goes to work out, and then it's like packing the lunches. And like this morning, they were up at 8. Ivy still had to do her homeworks because if she didn't, she wouldn't get a sticker.
What time do they go to school?
8:30, 8:50 is when I drop them off.
Okay, because our bell rings at 8 o'clock.
Oh yeah, our bell rings at 8:50.
Oh, okay.
So we get that extra, which is kind of nice. If there's no way in heck we're getting to school if we have to be there at 8.
School?
3:30.
Okay.
3:30, 3:40. Yeah.
Oh my gosh, Aileen's at 7:40.
Really?
Yeah.
Well, 3 different cities.
Yeah.
Wow.
And Julian's at 8:30.
Yeah. So it's just
Because they have different middle school, high school, and elementary have different time starts.
Right. And they're just not, I need to make them more self-sufficient because they could go get themselves a drink. They could probably go warm up a pancake. No, they can't do that. There's just things that
they could.
They could.
They could.
Aileen has tried to cook gummy worms before.
Gummy worms.
Like
Addie can cook popcorn. She came out with a bowl of popcorn and I was like, looked at Lisa and I was like, did you do this? And she's like, no. And I said, Addie, did you make this popcorn? Yep. She took a chair, took it over to the pantry, got it down, took it over, and we have a higher up microwave.
That's what I'm thinking is my microwave's too high. I was not going to teach them how to get a chair to get up on that thing.
Oh, Aileen has step stools.
Yeah.
So she pulls her step stool over, gets in the microwave. She tried to bake a cake once. She used not flour. I can't remember what flaxseed maybe that we had. It was not delicious.
Did you still try it?
I mean, I did not. No, I did not.
She could have been onto something. She might have had the best recipe of cake.
It was eggs and flaxseed. It was not good. Yeah, and
high protein cake.
It was
very something.
It was very high protein,
high fiber.
very healthy.
People are looking for that these days.
Yeah, that's true.
One morning, and so it was probably like 6 o'clock in the morning, and Addie was sitting on the island in the kitchen with the tub of mint chocolate chip ice cream, the whole tub, sitting on the table. I'm like, hi, what you doing? The other day I came home from the gym and I saw the light and I'm like, oh, okay, everybody's up. Nope, just Addie. And I'm like, oh, how long have you been up and by yourself?
Yeah. That's frightening.
Yeah.
Yeah. I know.
It's so funny, just the personalities of these girls.
I love
Because
them.
Pierce would see both of them out there and be like, get down. Like he would just
Oh, no.
not have it.
And then the girls would be like,
yeah.
No, they're
hell
so
no.
sassy,
Yeah,
bossy, independent.
they are.
Ooh, they are a force. That is for sure.
Mm-hmm.
So fun lightning round. What's your coffee order?
Caramel latte with oat milk.
Oat milk, solid.
Ooh.
Oat milk's so good.
Yeah, I'm lactose intolerant.
Go-to karaoke song.
I hate karaoke.
What's a hidden talent?
I can do taco tongue.
What?
Oh. Is that a talent? I don't know.
Aileen can do it too, though.
You just got...
Yeah. See, we can all do it.
Sweet. I didn't know I had.
So is it really a talent?
I don't know.
Now
Most
when
people
someone
don't.
asks me how they always ask, some people ask that question, what's your talent? And you're like, I don't have one.
Taco
now
tongue.
It's going to be,
Taco
I know
tongue.
one. I have one.
You got a talent.
I have
taco
talent.
tongue. A word that best describes the season of your life right now.
Fall? Like in so many ways. We're falling apart.
We're falling apart. It's the fall season.
It's the fall season.
I was going to ask one more, but I think I'm going to end on that one.
It is. 'Tis the season to be fall. It's great.
Falling
It's-
apart.
I know. I just had an aha moment because both of Ivy's birthday and Pierce's is in November.
Oh, Lord.
And 2 days ago, I'm like, it's almost Christmas. And I haven't
Yes.
gotten a dang thing.
No.
Crap.
I
I mean, Black Friday's coming up, which is always great. But I think we're majority of people. But I'm like, I feel like I'm not even prepared for that. And I never am. Every year comes around and I'm always thrown off by it's almost Christmas.
Fast too. Yeah.
I know.
Well, Dr.
Ugh.
Lisa, thank you for coming in.
Yeah.
hanging out
Yes,
with us
thank
today.
you. Thank you so
And
much.
all of that.
Did awesome. Did
Thanks.
awesome. It's always nerve-wracking, you guys, being on this side. When a camera's in front of you, it's
I
like
know.
you forget your words. But you did awesome. So good. So good.
I'm still learning how to do this.
We're still.
That's fine.
What episode is this? 8, 9,
Maybe.
10? I
I'm
don't
not
know.
sure.
Yeah,
But that's okay.
we're still learning.
All right.
Okay.
We'll see you next time.
Bye, guys.